Occupational English Test. Listening test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1.
Extract 1. Questions 1 to 12. You hear a physician talking to a patient called Jamila Begum. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, doctor.
Hello, Jamila. Can you brief me about your health issue?
Yes, doctor. Actually, I approached a physician about my abdominal pain 8 months back. On my chest x-ray, I had a possible infiltrate, and he thought that I might have pneumonia, and I was treated with some antibiotics and prednisone. However, the symptoms improved for a short period only, and it didn't cure my disease completely. Besides, my pain had worsened by the end of the month, and I was admitted to an emergency ward. This time my chest x-ray was compatible with pleurisy, and I was treated with Percocet. However, I was given another prescription for Ultram since I had nausea and was vomiting with Percocet. Eventually, I was referred to another doctor and was diagnosed with splenomegaly. A repeat ultrasound showed an enlarged spleen of 19 centimeters. My positron emission tomography scanning showed diffuse hypermetabolic lymph nodes of 1 to 2 centimeters diameter and an enlarged hypometabolic spleen. Finally, I had my lymph node biopsy on the right side of my neck last month, and mantle cell lymphoma was detected. 2 weeks ago, I had a bone marrow biopsy that showed involvement of bone marrow with lymphoma and also circulating lymphoma cells on peripheral smear.
And your age?
45, doctor.
Okay. What medications are you taking?
Estradiol, Prometrium, 200 milligrams, Ultram whenever I get pain, baby aspirin, Lunestra for sleeping, and iron supplements.
Are you allergic to any medicine?
No, doctor.
Tell me about your previous medical history.
Yes, doctor. I got my tubal ligation in 2001, and a cyst from the left side of my neck was surgically removed in 2005. I had tonsillectomy, and I get occasional migraines.
Do you smoke or drink?
No, doctor.
May I know your job profile?
Well, I'm working as a project manager.
Tell me, is there any family history of diseases?
My father had emphysema and colon cancer when he was 68, and my mother has hypertension and arrhythmia.
Well, your HEAT diagnosis shows the oropharynx is benign. There is shoddy adenopathy in your neck, though, and your abdomen is soft and non-tender and shows the palpable spleen approximately 10 centimeters below the right costal margin. Your mantle cell lymphoma is confirmed, and I would advise that you should go for chemotherapy with hyperfractionated cyclophosphamide, dexamethasone, doxorubicin, and vincristine. Discontinue aspirin for now and continue estradiol and prometrium. Take Ativan as and when you feel anxiety. You'll be given allopurinol from today and hydration further so that you can avoid tumor lysis syndrome. I will plan to add Rituzan a little later on in your course since you have circulating lymphoma cells, and I'm planning to get you evaluated for bone marrow transplant in first remission.
Extract 2. Questions 13 to 24. You hear a doctor talking to a patient called Daniel Anderson. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi, it's Daniel, isn't it?
Yes, Daniel Anderson, that's right. Hi, Dr. Hampton.
I haven't seen you for quite a while. What brings you in today?
Yeah, I probably should have come in before now.
Okay, well, that's fine. So how can I help?
Well, basically, over the last couple of weeks, I play football on Sundays, and a bit more than a couple of weeks ago, I was getting a bit more tired than I used to be. Like, I'd get out of breath in the game, I'd get puffed out. But more recently, it's been little things like walking up and down the stairs and stuff like that. That's got me a bit tired as well. So I was just wondering what's wrong with me, really?
Okay. When did you first start feeling poorly? Can you remember?
That's the thing. I had a cold, you see. Well, I thought it was a cold. I had a sore throat, and I was quite under the weather for that, but I've never really recovered since then.
And how long ago was that?
That'd be about a couple of months ago now.
Couple of months. Did we see you with that?
Well, so I made an appointment on the phone, but I didn't come in the end.
No, I didn't see you on the computer. So you just basically managed that yourself and...
Yeah, I thought it was getting better, but it's never really... I suppose that's never really gone away entirely. So maybe it was something more than a cold. I don't know.
Okay. What symptoms were you getting with that cold at the time?
Bad sore throat. My glands felt quite big as well. So I was just really tired, really, no energy.
Were you short of breath at that time during the cold?
Yes, but not as much now. That's why I've come in now, because it's gotten worse. It's got a bit more noticeable. But the cold symptoms have gone away now, pretty much. I still get a bit of a sore throat every now and again.
Right, okay. When you're at rest, do you get short of breath?
No.
No. Okay. Ever had asthma?
No, I've never had asthma or any sort of chest problems as far as I can remember. Nothing like that.
And do you have a particular diet? Are you a vegetarian or anything?
No, I'm not a vegetarian, but I hardly eat any meat either. I eat a lot of fried rice and instant noodles from the university cafeteria. The food's quite cheap. I know I should eat fruit and vegetables, but I'm a student. I suppose my diet is terrible if I think about it. Some days all I'd have is instant noodles and some hot chips and the usual 4 or 5 cups of coffee.
You drink a lot of coffee then?
Yeah, it keeps me going with all the assignments and things.
Okay. Have you noticed any problems with abdominal pain or indigestion?
No, nothing severe, no.
Nothing severe? Have you had some from time to time?
No, not really. Well, I've had some mild discomfort occasionally, but that could just be indigestion, I suppose. I don't know, it's something I've had on and off for years, really. It's nothing new.
It's nothing new, okay. Any nausea or vomiting with this?
No.
What about your bowels? Have they been working normally?
Yes, been fine. I haven't had any diarrhea or anything.
In particular, not past any black or very dark motions?
No, nothing like that.
And what about family history? Is there a family history of people getting anemic, for example, for any reason, as far as you're aware?
No, not that I can think of.
No one's had any sort of blood disorders or anything?
No, nothing like that, as far as I'm aware. My parents are very fit and active, and my brother doesn't have any health problems that I know about.
Right, so they're all fine as far as you know. So, Daniel, did you have an idea in your own mind what this might be?
I thought it maybe could have been related to the cold I had, because one of my friends did have glandular fever around like a few months ago, because my glands were up. I thought it could be related to that.
That is the end of part A. Now look at part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Question 25. You hear a physician explaining about the use of thimerosal in vaccines.
Thimerosal is a mercury-based preservative that has been used for many decades in the US in multi-dose vials of medicines and vaccines. There is no significant evidence of side effects caused by the mild doses of thimerosal in vaccines, except for minor reactions such as redness and swelling at the injected site. However, during 1999, the Public Health Service agencies, the American Academy of Pediatrics, and vaccine manufacturers agreed to reduce or eliminate thimerosal usage in vaccines as a precautionary measure. Methylmercury is obtained from certain kinds of fish. A high exposure to methylmercury can be toxic to people. However, over a lifetime, everybody is exposed to some methylmercury. Thimerosal contains ethyl mercury, which is the most widely used form of organic mercury that is cleared from our body more quickly than methylmercury and is likely to cause any harm to the individuals.
Question 26. You hear a discussion between a doctor and nurse about bronchodilators used to treat chronic obstructive pulmonary disease. Now read the question.
Hello, doctor. What are the different types of bronchodilators used to treat chronic obstructive pulmonary disease?
Patients with chronic obstructive pulmonary disease are often prescribed a bronchodilator, a type of medication for relaxing the air passages to help breathe better. Typically, the medications are inhaled through the mouth using a metered dose inhaler, but also come in liquid, pill, injectable or suppository formulations. The 3 classes of bronchodilators commonly used to treat chronic obstructive pulmonary disease are beta-adrenergic, beta-agonists, anticholinergics, methylxanthines. Beta-adrenergic agonists are a type of medication that binds to specific receptors in the lung called beta-adrenoceptors. By doing so, they block the trigger to bronchial spasms and allow airway passages to open. Beta-agonists can either be short-acting or long-acting, which are delivered either orally or through a metered dose inhaler. Generally, the inhaled method is preferred as it alleviates symptoms faster. Anticholinergic blocks the neurotransmitter acetylcholine in the central and the peripheral nervous system to its receptor in nerve cells and inhibit parasympathetic nerve impulses. Methylxanthines affect not only the airways but stimulate heart rate, force of contraction, and cardiac arrhythmias at high concentrations.
Question 27. You hear a doctor explaining to the nurses about the growth hormone test. Now read the question.
Growth hormone test. The growth hormone is very essential for the human body to grow. To find out why the growth of a child is slow, a growth hormone test called arginine and clonidine stimulation test is performed that will indicate the secretion level of growth hormone in the body. The child will be injected with 2 types of medicines during this test, namely arginine and clonidine, that will cause the body to secrete the growth hormone. Biochemically, the growth hormone reserve of the child is defined by the peak serum concentration after stimulation with a known secretagogue. While performing the test, Nurses draw 5 blood samples at specific intervals to observe how many growth hormones the body is secreting. Prior to the test, the child should not be allowed to eat or drink anything except water after midnight. The test takes about 6 hours, so the child should be clothed comfortably. Generally, a short-sleeved shirt is suggested during the test. The nurse on duty should make sure whether the child is on any medications before scheduling this test, and they should explain to the parents of the child about the process and outcome of this test. The test will be performed in an endocrinology outpatient clinic, and the nurse should measure the weight and height of the child. Then the child will be taken into the patient room equipped with the intravenous catheter, which is used to inject the arginine into the child and to take the blood samples. However, the clonidine will be fed through the mouth in liquid or in pill form. This may lower the blood pressure and cause the child to sleep, so the nurses should keep on measuring the blood pressure of the child during various intervals. The child may be given fluids to drink during the test. However, before discharging from the clinic, the child should be able to eat and walk around. The child may feel tiresome throughout the evening.
Question 28. You hear a senior nurse giving feedback to a trainee after a training exercise. Now read the question.
Okay, that went quite well, didn't it? But it took you a while to work out where the CPR board was kept.
Yeah.
So, what does that tell you about this scenario?
We need to check where things are before doing anything else.
Exactly. And of course, it takes a second or two to put the head of the bed down, because you've got to have that part of the bed flat before you slip the board in. I wish there was a quicker way.
So, do I put the CPR board under, or would I normally hand it over to somebody else?
It makes no difference as long as it's done.
Question 29. You hear a discussion between a doctor and a nurse on leukopenia disease. Now read the question.
Hello, doctor. Can you explain to me what is leukopenia disease?
Well, leukopenia is a condition where the patient has lesser white blood cells in their bloodstream, which is diagnosed with a blood test called a complete blood count. There are 5 types of white blood cells, and each of them protects the body from a different kind of infection. Neutrophils make up 55 to 70% of total white blood cells, and they fight off fungal and bacterial infections. Lymphocytes protect the body from viral infections. Monocytes are the largest of the white blood cells, and they fight against bacteria, fungi, and viruses. And they mend tissue damaged by inflammation. Basophils are involved in inflammatory reactions to allergens. Eosinophils fight parasites and play a role in allergic reactions and conditions, such as asthma.
Question 30. You hear a discussion between a nurse and a doctor on Crohn's disease. Now read the question.
Hello, doctor. What are the different types of Crohn's diseases?
Well, Crohn's disease is a chronic, incurable disease that can cause inflammation anywhere along the digestive tract. Crohn's disease is characterized by symptoms of abdominal pain, diarrhea, cramping, weight loss, bloating, and blood in stools. Crohn's disease affects people differently, mainly due to the different types of the disease and the areas they affect. The most common types of Crohn's disease are ileocolitis that affects the colon and adjacent ileum, jejunalitis affects the jejunum, ileitis affects the ileum, Crohn's granulomatous affects the colon, Gastroduodenal Crohn's disease affects the stomach and adjacent duodenum.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear doctor giving a lecture to the junior doctors on lung carcinoid tumors. You now have 90 seconds to read questions 31 to 36.
We all know that cancer begins when the cells begin to grow out of control. Cells in any part of our body can become cancer and can metastasize to other parts. Significantly, lung carcinoid tumors are uncommon and grow slower compared with other types of lung cancers. Lung carcinoids are made up of special cells called neuroendocrine cells. Before we try to understand lung carcinoid tumors, it is essential to know something about the structure and functionings of the lungs, as well as the neuroendocrine system. Our right lung has 3 sections called lobes, and our left lung has 2 lobes. The left lung is smaller because the heart takes up room on that side. When we breathe in, air goes into the lungs through the trachea. The trachea divides into tubes called the bronchi that enter the lungs and further divide into smaller branches called the bronchioles. At the end of the bronchioles, there are tiny air sacs called alveoli, from where many tiny blood vessels run through. These blood vessels absorb oxygen into the bloodstream and pass carbon dioxide into the alveoli, which is exhaled. Therefore, the main function of the lungs are inhaling oxygen and exhaling carbon dioxide. A thin lining, known as the phleura, surrounds the lungs, which protects the lungs and helps them slide back and forth as they expand and contract while we breathe. Phleura capacity is the space inside our chest that contains the lungs. A dome-shaped thin muscle called the diaphragm below the lungs which separates the chest from the abdomen. Therefore, while we breathe, the diaphragm moves up and down, forcing the air in and out of the lungs. Lung carcinoid tumors develop from the cells of the diffuse neuroendocrine system, made up of the cells that are similar to nerve cells and hormone-making endocrine cells. These cells do not form an actual organ like the thyroid or adrenal glands. Instead, these cells are scattered throughout the body in organs such as the intestines, stomach, and lungs. Neuroendocrine cells secrete hormones such as adrenaline and similar substances. This may help control airflow and blood flow in the lungs and may help control the growth of other types of lung cells. Neuroendocrine cells may detect the oxygen and carbon dioxide levels in the air we breathe and then discharge chemical messages to help the lungs adjust accordingly. For instance, people living at higher altitudes will have more lung neuroendocrine cells because of the decreased oxygen level in the air they breathe. At times, lung neuroendocrine cells undergo certain changes, causing them to grow big and form tumors. These are known as neuroendocrine cancers. Lung carcinoid tumors are a kind of neuroendocrine tumor. However, neuroendocrine tumors can form in any part of our body. Stomach is another common site for neuroendocrine tumor formation. There are 4 different types of neuroendocrine lung tumors. Starting with the aggressive growth of the cancer, the 4 types are small cell lung cancer, large cell neuroendocrine carcinoma, atypical carcinoid tumor, and typical carcinoid tumor. Small cell lung cancer is one of the aggressively growing and spreading tumors. Large cell neuroendocrine carcinoma is a rare type of cancer. It is a subcategory of non-small cell lung cancer, though it grows aggressively like small cell lung cancer. Typical and atypical carcinoid tumors are carcinoids that appear different under the microscope. Typical carcinoids grow slowly and they rarely spread beyond the lungs. 90% of the lung carcinoids are typical carcinoids. Atypical carcinoids grow a little faster and they are likely to spread to other organs. They contain more cells in the process of dividing and they appear more like a fast-growing tumor. Unlike the typical carcinoids, atypical carcinoids are uncommon. At times, carcinoids are classified by where they develop from inside the lung. Central carcinoids form in the bronchial walls near the center of the lungs, and most lung carcinoid tumors are central carcinoids, which are also typical carcinoids. Peripheral carcinoids form in the bronchioles towards the outer edges of the lungs.
Now look at Extract 2. Extract 2. Questions 37 to 42. You hear the discussion between a senior doctor and junior doctors about pemphigus. You now have 90 seconds to read questions 37 to 42.
Hello, Doctor. Can you please explain what is pemphigus?
Well, pemphigus is the term used to describe a group of autoimmune diseases which cause the skin and mucous membranes to become blistered. The diseases may affect areas of the body such as the mouth, eyes, nose, throat or genitals. In certain cases, these diseases may be fatal if they are left untreated. Pemphigus disease affects the people from different and ethnicities. However, some studies have shown that individuals of Mediterranean descent and European Jewish individuals are more prone to these diseases. One form of the disease is very common among people who live in the Brazilian rainforests. Pemphigus affects men and women equally, and several studies have proved that the diseases are associated with a genetic predisposition to developing them. The onset of disease symptoms usually begins during adulthood, although symptoms have been found to occur in children. Depending on the layer of skin blistered and the location of the blistering, there are several forms of pemphigus. The blisters always appear on or near the skin surface. Pemphigus vulgaris is the most common form of pemphigus, which affects the mouth first. That can be painful. The blisters will start appearing on skin and mucous membranes that were looking healthy previously. They form inside the deep layer of the epidermis, making the skin so delicate that simply rubbing it with a finger causes it to fall off. Normally this kind of blisters heal without causing any scarring. However, some parts of the skin that have become pigmented may last several months. Pemphigus foliasis is another common type of pemphigus, in which blisters or crusty sores initially develop on the scalp and face. However, other areas of the body such as the chest is affected at a later stage. Often the lesions are itchy, but are not as painful as those that develop in Pemphigus vulgaris. Areas of the skin may become moist, loose and scaly. Paraneoplastic pemphigus is a rare condition that is not actually pemphigus, but shares certain characteristics of the disease. It develops in individuals with certain cancers and results in ulcers forming in the mouth and on the lips. The skin also becomes blistered and the eyelids may become cut and scarred. The antibody that binds to the surface of epidermis cells also targets the membranes of the airways, and hence patients with this condition can develop fatal lung problems. In the IgA pemphigus, the immunoglobulin A, an antibody different from other antibodies, is involved in other forms of the condition, binds to the epidermis cell surface. The blisters are similar to those that develop in Pemphigus foliasis, but at times they are pus-containing bumps. IgA pemphigus is the least harmful type of pemphigus. Pemphigus vegetans causes thick sores to arise under the arms and in the groin area.